Today we are going to be demonstrating inserting an NG tube, internal feedings, as well as removing an NG tube. So for inserting an NG tube, I want to verify my physician's orders, which I've done, and now I want to verify my patient. Hey, Mr. John, I'm Allie. I'll be taking care of you today, and we're going to do an insertion of an NG tube. Can you please state your name and date of birth for me? All right, perfect. So now that I have verified my patient, I'm going to perform hand hygiene, and I'm going to don clean gloves. All right, and I want to go ahead and place my patient in high Fowler's position, which he is in. I want to place a towel on his chest. I have a glass of water for him to take some sips while inserted, and then I have a basin in case he needs it. All right, so the next thing that I want to do is I want to check the patency of my nostrils. All right, so I'm going to be using the right nostril for this procedure. So now I want to take my NG tube and I want to measure. So I'm going to take, and I'm going to do from the tip of the nose to the top of the ear and then all the way down to my xiphoid process. And I want to use a piece of tape and mark that measurement. So I want to lubricate my NG tube. And Mr. John, if you will put your head, chin, and chest and take a few sips of water for me while I insert this. So take some sips, take some sips. And while I'm doing this, I'm assessing for any signs of distress like hypoxia or gagging or gasping and stuff. So now that it's in, I want to do a temporary securement. So, all right. So now we want to verify our placement here. So to verify the placement, I want to pull back some gastric content. I'm going to do about 10 milliliters. All right. And I want to check the pH of this. All right, so the pH is checked and it is acidic, which is where we want it to be. So now I'm going to send my patient to get a chest x-ray. All right, so my chest x-ray comes back and my patient or my NG tube is in the correct placement. So now what we want to do is we want to do a better securement of that NG tube. So I want to remove my temporary and I want to secure it a little better. All right, so now this NG tube can be connected to suction or feeding or as needed. So the next thing I want to do is I want to remove my gloves and perform hand hygiene. I want to document my procedure. I want to document which nostril I use, the type and size of NG tube I use. I want to document all my gastric content, and I want to document my patient's response. So now to go over internal feedings, the first thing I want to do again is verify my physician's orders, which I have done. And now I need to verify my patient. Can you state your name and date of birth, Mr. John? All right, and do you have any allergies? All right, so he has no allergies. So again, I'm going to perform hand hygiene and don clean gloves. All right, so now that I have done that, I want to prepare my feedings. So I've got my bag and my tubing here. I want to shake it very well. I want to pour it into my bag, and I want to go ahead and prime my tubing. All right, so now what we want to do is we want to double check that placement of the NG tube. So again, I'm going to pull back some residual here. All right, I'm doing about 10 milliliters. And again, it's acidic, so now we want to check our residual. So I'm going to pull back all the gastric content, and I'm measuring this. We want it to be less than 250, which it is. So we're going to go ahead and put that back in, and I want to go ahead and flush with about 30 milliliters of water. All right, so now that I have flushed, I can go ahead and connect my two feedings. All right, and after I connected that, so you can do these a few different ways. You can do a bolus and gravity feeding, which you're going to connect to gravity. With these, you want to flush before and after. You can also set them up for continuous feedings, and with the continuous feedings, you're also going to have this on a pump. You want to flush every 4 to 6 hours or per your protocol of the facility, and then you want to flush again before and after that one as well. You also, with any type of feeding, you want to check your residual every 4 to 6 hours. If you have a PICC line or abdominal tube, you want to assess that daily and clean it. And I believe that concludes, oh, you want to document. So you want to document the amount, your intake and output, your residual content, the way your patient responded, the type of feedings, and all of your procedure that has been done. So now we want to go ahead and remove our gloves and perform hand hygiene, and that concludes internal feeding. So now for the removing of the NG tube, again, I want to verify my physician's orders, which I have done, and now I want to verify my patient. Hey, Mr. John, I'm Allie. I'll be your nurse today. We're going to be taking out that NG tube. Can you state your name and date of birth? All right, perfect. So now that my patient is verified, I'm going to perform hand hygiene and don clean gloves. All right, and with this, again, my patient is still in high Fowler's position. I have this towel underneath their chest as needed. I'm going to give them some facial wipes as needed. So now what I want you to do, or I'm going to actually stop my tube feedings. And all right, Mr. John, so we're going to remove this NG tube. And while I do this, I'm just going to need you to hold your breath. All right, so if you will hold your breath for me, and we're going to remove this slow and steady, and then we're going to dispose of this properly. All right, so now what I want to do is I want to go ahead and perform oral care and nostril care. I want to then remove my gloves and perform hand hygiene again, and then I want to document my procedure. I want to document my patient's response, and that concludes our thing.